Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right wisdom and the lower left wisdom and their association with the inferior alveolar nerve. Now, this is the panoramic view. On the panoramic view, we can clearly see that we've got the two wisdom teeth and you've got the inferior alveolar nerve highlighted in orange. And we can see that it is closely associated. Now, I'm going to take you through the proximal or the transaxial view, which will exactly show the relationship of the wisdom tooth to the ID nerve. Now, on the this is the right hand wisdom tooth. We can see that the highlighted part is where the nerve is. Now we're going to move from mesial aspect to the distal aspect. As we are moving distally, this is the mesial root of the wisdom tooth. The mesial root apex is just in close approximation to the inferior alveolar nerve. As we are moving more distally, this is the interradicular area. We see that the nerve canal moves upward towards the tooth, and as we move to the distal root, we can see that the inferior alveolar nerve is on the lingual aspect and the canal is actually compressed. A canal compression is actually a classical indication that the nerve is in direct contact with the root surface. So this we can see it's no longer circular, and this crescent shape means that on the lingual aspect the canal is being pushed by the root, and as we are moving, and we can see that it gets thinner, and as we move distally we see that the canal morphology comes back and it is now perfectly rounded in shape, and this is moving up towards into the ramus. So this is the inferior alveolar nerve. On the right hand side we can see that it is in very close approximation to the wisdom tooth, and the extraction of this wisdom tooth, there is a chance that the nerve can be damaged. Now moving to the lower left hand side. On the lower left hand side, this is the proximal view. This is the lingual side. The lower left wisdom teeth, we can see that they are much more safer in the lower left region. This is the inferior alveolar nerve. This is the tooth. As we are moving distally, we can see that the roots do come in close association. Here it's just inferiorly to the apex, and then as the root moves up, we can see that the root is in very close approximation, but as the canal morphology does not change from round, we can safely say that the nerve is not being compressed by the wisdom tooth, but apical pressure during extraction can result in the inferior alveolar nerve being damaged. So it is there, we can see that it is completely very closely attached, right? This is the nerve canal, and there we go, and this is the root. So it's very close to each other, but as we move from the mesial to the distal aspect, we can see that the nerve does not get compressed, but the nerve definitely is just touching the inferior alveolar nerve canal. So this is the left hand side. We show you from the axial view. On the axial view, we can see that the nerve is very closely associated with the left hand side distally, and on the right hand side we can see that as we move apically, this is where the nerve gets very thin. There we go, that's where the nerve moves in, and this is where it is in very close contact. On the right hand side we can see that it is relatively far away, but as we are moving below, it does come in very close contact with the nerve. So this is on the axial view. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.